Welcome to the 2023 NNLM Virtual Symposium on Health Misinformation. We're really glad you're able to join us today. My name's Liz Morris, and I'm an Outreach and Access Coordinator with NNLM, and I'll be your host for today's session. We have just a few technical items to cover before we get started. All attendees have been muted, but we do welcome your questions and comments in the Zoom chat at any time. VFairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu when posting your comments in chat to ensure that everyone sees them. If you have questions specifically for the speakers, please use the Q&A function to ensure that they don't get lost in the chat dialogue. We also have live closed captioners for this event. You can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event, which is HealthMisinfoNNLM. Before we get to our presenters, I'd like to share a little bit about who we are. The National Institutes of Health is the nation's leading medical research agency. NLM, or the National Library of Medicine, is one of the 27 institutes and offices at the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, or the Network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. We have 2 presentations during our hour today. As a little bit of context for how this will go, we'll hear from our first presenter, and then we will transition right into our second presentation and hold Q&A for all presenters till the very end. So it's my pleasure to introduce our first speaker, Erin Bowen. Erin is a reference and instruction librarian at Wichita State University. They'll be presenting on disentangling health misinformation and disinformation from media discourse through a teaching module, a follow-up from NNLM 2021. Welcome, Erin. I'm going to stop screen sharing and give you the reins.
Wonderful, thank you. Let me get my slides up here. Was that no? You guys see my slides, or can you see the back end of my slides?
So I see your presenter view right now, but just a second ago, I saw the slides themselves.
Okay, let's try this again.
So I see your slides here.
Okay, the slides themselves, not the presenter view?
Now I see presenter view. So whatever you clicked right before that.
Okay, let me. It wouldn't be Zoom without technical difficulties.
Yeah, they like to make it a little bit interesting.
Aha, okay, let's try.
There's your slides.
Okay, now that's over on the wrong screen on my computer, but you know what? I will just work with it, and that works just fine. Okay, so hello, and thank you for having me, everyone. Let's get the chat open so I can see it. Yeah. Thank you for having me, everyone. I'm Erin Bowen, Instruction and Research Services Librarian at Wichita State University. Not with us today, but no less integral to the success of this project is my co-author, Amy Drassen Ham, who is a medical anthropologist and clinical professor here in WSU's Department of Public Health Sciences. She teaches the courses in which I am piloting a revised version of a misinformation and disinformation in public health teaching module, which she and I originally began developing in 2021. As some of you may or may not remember, I presented to this conference about our initial efforts to develop this module that year. Amy and I have worked together since 2015, but she came to me with a new level of alarm in 2021 when she began to realize how bad the problem of misinformation and disinformation in the health sciences was getting. Driven in particular by COVID-19, but as you'll see during my presentation, whereas the 2021 version of this module was COVID specific, the current version expands to additional public health science topics and issues as well. So here is what I will cover today. I'll begin with some views of the module itself, both in 2021 and now. I'll outline the module's 6 sections and get into some critical thinking questions stemming from each of the sections of the module. Dr. Drassen Ham and I are in the process of designing assignments stemming from the module as well, so that she can deploy these assignments to her classes. So I'll talk a bit about that in connection to these critical thinking questions too. Now, I do have a confession to make. Part of the reason we are currently designing assignments instead of presenting them already completed with student evaluation data in hand is that we are not as far along in this project as I thought we would be, because sadly, my dad passed away this February, and I've had to take time away from my professional projects to plan his memorial service, work with the funeral home, etc. So I'd like to dedicate my talk today to him. Both he and my mother got to hear my 2021 presentation. So here is what the module looked like back then with its COVID-specific details. And then here's what it looks like now with this broader public health focus. As I'm sure many of you will recognize, this module is built natively in Blackboard, the Blackboard Learning Management System, which WSU uses throughout its curriculum as its LMS system. Over a decade now, I published one of the first, it wasn't the first, but it was one of the first papers establishing that if libraries make their content available in a learning management system, students will indeed go there, as opposed to searching for information on the free web. So I know you all have your own experiences, which may or may not match mine, but my experience has been that students are well aware of the different characteristics that constitute value in information. The slippery characteristics of the purpose of the information, the process through which it was created, the credibility of its authors, etc. My experience is that students are quick to recognize that the different characteristics of information vary widely from source to source. They just don't often feel like they have the tools to help them reliably make judgments of this nature, or to help them seek out, find, and access quote unquote high value information to include in their coursework. That's where this module comes in and why it is developed natively in Blackboard. So here is what I will cover today. Part of the challenge of sending my slides in 2 weeks ago and presenting them today is, of course, elements of both the presentation and module have changed since then. In particular, the contents of what was the introduction and what was the truth, facts, and their relation to each other sections 2 weeks ago have essentially traded places with each other. My initial thought was to begin by helping students understand the parameters of what constitutes both misinformation and disinformation, with an eye towards helping them constitute sophisticated working concepts of each. Well, as I continued developing the module, I found it effectively impossible to ask students to take on such a straightforward yet highly conceptual undertaking. Take on such an undertaking like that without first Come on. There, sorry. Without first entering into a discussion of how empirical facts can be derived and measured. How an amalgamation of facts supported by empirical evidence form a representation of truth. And yes, I really do go back to both Plato and Aristotle to discuss forms of representation, like with Plato against the cave wall, and Aristotle's conceptualization of truth, as well as the famous lines attributed to Mark Twain and Senator Daniel Patrick Moynihan, respectively. A lie can travel halfway around the world while the truth is putting on its shoes. And from Senator Moynihan, everyone is entitled to their own opinions, but not their own facts. I don't dwell on these historical figures, though, and I do introduce contemporary discussion of facts and truth, such as Caitlin O'Connor and James Weatherall's book on misinformation. I also teach a live guide that I developed on fake news back in 2016 or 17. There it is. I teach fake news as a specific strain of disinformation rooted in journalism in particular. So, along with this discussion, I offer a discussion of the value of empirical information to members of a free and open society, able to have an informed understanding and make informed decisions about the world around them. I introduced the concept of institutions, which Douglas North, who is a political economist, Douglas North describes as the humanly devised constraints that shape human interaction and that structure incentives in human exchange, whether political, social, or economic. North goes on to distinguish between institutions and organizations, which he acknowledges themselves form rules to human interaction. But in contrasting institutions and organizations, he notes that organizations include political bodies, such as political parties, the Senate, a city council, a regulatory agency, economic bodies, such as firms, trade unions, family farms, cooperative, social bodies, such as churches, clubs, athletic associations, and educational bodies, such as schools, universities, and vocational training centers. Now, institutions, by contrast, are the overarching endeavors, such as the higher education institution or the banking and finance institution. When we speak of the medical establishment or of the fourth estate, we are describing the healthcare and journalism institutions, respectively. So essentially, I want students to understand that much of contemporary society is comprised of institutional players, and that alongside individual actors or groups of actors on the internet, these institutions produce and disseminate information. So from here, I introduce a discussion of epistemology, the subfield of philosophy that essentially wrestles with the question of how we know what we know. Rather than diving too deeply into the volumes of scholarship that philosophers have written on the topic, I ask students to view epistemology through the lens of differentiating between information, misinformation, and disinformation. To this end, I asked them to listen to a podcast recorded at the end of 2018 between two journalists who happen to have philosophy backgrounds, Chris Hayes and David Roberts. In framing epistemology, Roberts contrasts the empirically derived evidence with preconceived ideas. He states that, well, the broad public is not at all stupid, which he's very careful to state explicitly, but the broad public, people do not think like scientists, he says. Students keep an open mind to, I'm sorry, people do not think like scientists. Scientists keep an open mind and draw no conclusions until they gather evidence, and then they let the science speak to them. It is difficult even for scientists, but of course, normal people don't think like that. Most people, most of the time, think like lawyers, i.e., they have a case. They have their conclusion in hand, and they're going out, gathering information, and trying to build a case for it. Where do these preconceived ideas come from, and how do they get formed? Hayes and Roberts' discussion points points to the epistemically related idea of trust in information, which is in some ways really the end goal to which consideration of facts and evidence seek to lead us. Some scientific phenomenon we can observe directly, such as the force of gravity exerting itself on humans and objects daily. Other observations we have no way of directly measuring, so we rely on others to faithfully and credibly report facts. How do we know the Earth is 4.5 billion years old? Because Caltech scholar Claire Patterson calculated the planet's age based on samples of soil strata and published his findings in 1956. Short of directly taking our own soil samples and understanding how scientifically to measure them, we rely on his reporting and his findings in enough scientific detail that we can rely on his account. We place our trust in the information he offers us, partly because he does present the empirical underpinnings of his work, but also because we can't directly verify every last fact about the world around us. So trust in information provided by others is critical to any understanding of that world. Now, Hayes illustrates this principle and connects it to institutionalism in a separate writing, where he writes that if you trace claims of knowledge a few links, you inevitably find it attached to some bedrock of institutional authority. Without these actors, our basic knowledge structure threatens to drift away. So, of course, the major challenge comes in the reality that many sources of disinformation directly try to break those chains, to minimize institutions and to diminish any claims that institutions have as being any sort of authority over a particular topic.
Aaron?
Yes.
Sorry, this is Liz, the host. I just want to quickly check. We're still on slide 8 on our screen. Is that where you would like us to be? Perfect.
Yes.
Thank you.
Yep.
Thank you.
This, as you'll see, this wound up being kind of the meat and potatoes of my work. So it's worth diving into.
Of course. Yes. We just had some questions in chat about it. Thanks.
Yeah. Part of disinformation seeks to diminish the influence of actors like this. Another news commentator, Rush Limbaugh, famously called government, academia, science, and media the four corners of deceit, and went on to illustrate this point by saying, who is in universities? Left-wingers, liberals. What are they doing? Promoting liberalism. They're not teaching anything. They're programming people. They have political conclusions. They want certain things to be certain ways. They have the power of science behind them. They simply create circumstances in their minds, and they write peer-reviewed articles that indicate studied research data and so forth. We need to really start questioning how much of all this clinical social psychology that we have been told is irrefutable science is nothing but fraud. So he didn't present any reason why we should question the veracity of peer-reviewed science and instead view it as fraud. That really wasn't his point. His point was to undermine other institutional sources of knowledge in an attempt to get his listeners to reject empirically derived observations and instead just listen to him as a voice of authority, regardless of his lack of scientific training. And I checked into it. He dropped out of college after 1 year. So, but there he is, posing himself as an authority, a scientific authority, trying to discredit other institutions of science. Now, I'm not trying to suggest that we can't have scientific disagreement on a given point. Of course we can. We can even have empirical observations and data that don't always suggest a clear picture of reality. That is, however, a very different situation than the group production of nearly all disinformation that has flooded the web, which is rooted in half-truths, selectively ignoring evidence, and outright fabrication. So, undermining institutions and empirical observations is essentially how the purveyors of disinformation seek to drive a wedge between fabrications they develop and evidence to contest these fabrications. As you can see, in some ways, this introductory section became the meat and potatoes of the module, as I said. But rest assured, there is a lot more to talk about here. No, not that slide. So following from that background, I get into a discussion of how we can define and understand misinformation and disinformation based upon the underlying concepts that I've described. Baines and Elliott present a conceptual discussion of it, and Capantani offers a systematic review of different definitions and understandings presented in the literature. I should note that neither of these studies is infallible. Both leaves holes in terms of an understanding of misinformation and disinformation, but they do help get a conversation started. And Armstrong and Naylor and also Tonsaker help tie this conversation to public health. I've got references to those articles at the end of the presentation. So the influence of the internet is, of course, it takes central stage now too. Brandy Zadrozny is a former librarian turned journalist who writes about the spread of mis and disinformation via electronic means. Ben Collins is another journalist who does the same from one of the sources listed in the chat. I also go into sections of Frankel and Kong's 2021 book about Facebook that deal with content moderation. So I did intentionally try and weave journalists into the module's content alongside scholarly voices. I find their voices both important and relevant, and they help translate scholarly content into a more accessible layperson's format, which I think can help students derive greater understanding and value from the module than just scholarly voices alone. So, but this is something that I would like to investigate in an assessment of the module. I definitely make an information to tie all this material back to public health, such as sections of Oreskes and Conway's 2011 book about high-level scientific disinformation dealing with the tobacco industry in particular. I also introduced students to one of Claire Patterson's main scientific opponents, Robert Keogh, who, in addition to being a scientist, was also a paid lobbyist by the oil and gas industry. In 2017, oil and gas launched a prominent ad campaign they called Power Past Impossible to try and put their own spin on climate science for a lay public audience. In some, it presented mild disinformation rooted in half-truths. And as far as I can tell, it seems to have been abandoned very quickly. I'm not entirely clear why, if it was not having its desired effect or what. But then the process of cutting through scientific misinformation with regards to lead and water to arrive at health-based public policy in What the Eyes Don't See, a book I'm sure many of you have read. Mona Hanna-Attisha tells the story of disputing misinformation from some cases of government sources to now ultimately arrive at science-based public policy by virtue of the fact that the bipartisan infrastructure law, which that it really is its official title. The infrastructure law seeks to rip out every last lead pipe in the United States and replace them with safer pipes. So, and then I draw from all the literature that I've been mentioning to present possible solutions. Tonsaker, for example, suggests helping doctors engage with online health information from a patient's perspective, so that if a patient comes into a doctor's office having read something online, the doctor is literate to be able to help the patient by being familiar with what is being said about some health topic online. The same logic could probably be extended to public health science as well. And Armstrong and Naylor suggest that peer-reviewed journals can play a role by producing public health education and health literacy resources separate from the peer-reviewed material that they produce. And then a couple of other books talking about critical thinking and research skills that I have students take a look at. The critical thinking questions that I posed with the module back in 2021 are still there. I think they do a great job still today in helping students begin discussion amongst themselves of these types of issues. So, and as I say, Professor Drassen Ham and I are designing a set of assignments that we can deploy, asking students to design a response to confront misinformation, providing students with popular media content, and have them work in groups to determine what content is misinformation and what is not, have them work on rewriting it if they could. So there are a variety of different ideas for assignments that we can pose, and so Professor Drassen Ham and I are working on them. And also, like, very quickly, there, not sure if you all can see it, but I just wanted to give you all the sources that I had cited. And as I was working through my material, came up with some additional stuff, which I will paste into the chat. And I welcome any and all questions following the next presentation. So let me know what you would like to know.
Thank you so much, Aaron, and thank you for sharing your father with us and dedicating the presentation to him. Great to learn a little bit more about him. We already have a question in the chat that we will definitely address. We're going to leave about 10 minutes at the end for questions. So, Aaron, if you want to be noodling on that, that would be great. I'm going to go ahead and pull up my screen again so that we can bring our next presenters into this conversation. So I'm going to happy to introduce you to Victoria Yunus-Bem and Alyssa Doherty. Victoria is a certified nutrition specialist and director of nutrition science and education at the American Nutrition Association. Alyssa is a nutrition science and education specialist at the American Nutrition Association, and they will be sharing today on trusted nutrition, creating a standardized, evidence-based framework for the development of nutrition guidelines at the American Nutrition Association. So welcome, Victoria and Alyssa. I have stopped my share and we'll turn it over to you. Thanks for being here.
Thank you so much, Liz, and thank you, Aaron. If anybody can't see or hear, do let me know, but assuming that it's working. So I want to thank everyone here and the NNLM for hosting this conversation today. Thanks for joining for our talk called Trusted Nutrition, Creating a Standardized Evidence-Based Framework for the Development of Nutrition Guidelines at the American Nutrition Association. As Liz mentioned, my name is Victoria Yunus-Bem, and I'm the Director of Nutrition Science and Education for the American Nutrition Association, which we'll call the ANA. For short. And presenting with me today is Alyssa Doherty. She is Nutrition Science and Education Specialist with the ANA. And I'd also like to thank our collaborators who are working with us on this project. So the American Nutrition Association, just for a little bit of background, is a 501c3 nonprofit organization committed to translating science-based nutrition information and building nutrition literacy for health professionals and the public. This is all toward our vision of healthy people powered by nutrition. Again, we're dedicated to improving health literacy, and we're going to share today a little bit of how we aim to do that. We build nutrition literacy both through state and federal advocacy. So you can see our advocacy map here showing where nutrition practice is legal and where it is actually harder to be licensed as a professional. Different states have a variety of legal elements to them, which is very complicated, but you can visit our website if you'd like to learn more about that. But what I'd like to focus on today is how we educate regarding nutrition literacy, nutrition programming. So we have educational programming for professionals and the public, including our annual summit, including online continuing education courses for a variety of health professionals, such as physicians and nutritionists, and through programming to build nutrition literacy for the public in non-healthcare settings. Now, there are many barriers to nutrition literacy that individuals encounter that can impede the ability to make informed health positive decisions about nutrition. We eat every day, and while nutrition is the foundation of good health, providing essential nutrients and compounds for the function of every biological process, good nutrition is not taught consistently in communities and schools. Nutrition is not always employed as a strategy in healthcare settings, and more often than not, people lack consistent access to affordable, health positive, and culturally meaningful food. And let's face it, nutrition behavior change can be very difficult, and often long-term habits take a long time to develop. On top of all of this, nutrition is the subject of much controversy, misinterpretation, and sometimes misinformation in both public and professional spaces. While nutrition is one of, if not the most important determinant of health, societal nutrition literacy is lacking. Health literacy is defined by the National Library of Medicine as the degree to which individuals have the capacity to obtain, process, and understand health information and skills needed in order to make appropriate health decisions. Similarly, nutrition literacy has to do with the capacity to access, process, and understand nutrition information and the material goods that are needed to make those appropriate nutrition decisions. Health literacy and nutritional choices are associated. Without adequate health literacy tools and education, folks are more likely to make unhealthy dietary choices and misinterpret recommendations. Both low literacy and poor nutritional decision-making, or the inability to make healthy decisions due to external factors that are outside of people's control, are significant barriers to improving public health outcomes. Not only is there a health effect of low nutrition and health literacy, but according to the Center for Healthcare Strategies, low health literacy also translates to increased healthcare costs. In fact, an estimated $236 billion could be saved each year by improving health literacy. Particularly vulnerable populations are especially vulnerable to the effects of the cost burden, and this include lower income individuals, those receiving Medicaid, non-native English speakers, and the elderly, among others. Improving health literacy can be targeted by simplifying health information. Providing clear, culturally relevant health education empowers people to make healthy dietary choices in an enabling environment. With greater awareness of the role that nutrition plays in human health, individuals and healthcare professionals may also be apt to discuss nutrition in healthcare settings. Personalizing patient care has also been identified as an approach that can further enhance health outcomes. Developing literacy in any new skill is like learning a new language. It takes time, exposure, and practice. We first learn the foundations of a language, its sounds, cadences, letters of the alphabet, and basic vocabulary. Then we begin to understand its functions. We have the ability to apply what we're learning in the real world, and the foundations start to come together as we build the language. We understand what it all means. And as we start to internalize the structure, conventions, and context of the language, it becomes second nature. We can make connections, explain ideas and processes to others. In other words, we gain fluency. Being fluent in nutrition is really no different. We learn or relearn the foundations or the ingredients of good nutrition. Then we can begin to understand the functions and applications of foods, nutrients, and diets. And finally, we can begin to comprehend and internalize the ideas and conventions that we've learned and put them into practice in the real world. When a person becomes fluent in nutrition, they can begin to identify misinformation that doesn't align with what they've learned and can develop deeper understanding of how to apply nutrition in light of their unique needs and in their unique contexts. There are tools and materials that have been designed to enhance nutrition literacy in the United States. However, despite awareness that nutrition is one of the most powerful determinants of a person's health, and while public nutrition guidelines have contributed to the reduction of malnutrition and nutrient deficiencies in the United States, we're still facing a chronic disease epidemic. In fact, 7 of the top 10 leading causes of death in the United States are chronic diseases, most of which are considered preventable with good nutrition. 90% of total healthcare spending in the United States is attributed to care for Americans with health conditions. A 2019 study found that poor dietary choices in the United States resulted in $50 billion of healthcare each year. And a second study published that same year found that adherence to healthy eating patterns among US adults could save between $16 and $88 billion associated with cardiovascular disease, some cancers, and type 2 diabetes, as well as Alzheimer's disease and hip fractures, depending on the level of adherence and the index adhered to. These statistics emphasize the need for targeted, evidence-based, actionable, and effective nutrition information and recommendations that can be addressed in every sector of society so that good food is being grown, getting to markets and groceries, that people are learning about good nutrition through their education and in their healthcare settings, and that nutrition research and guidelines communicate relevant information to all of us. This is easier said than done. And unfortunately, nutritional science has a bit of a public image problem at the moment. At best, it's just confusing. It's estimated that 80% of Americans encounter conflicting nutrition information, mostly getting their information from online sources, which include things like TikTok and also blogs. Some of those can be good, but many are not necessarily educated in nutrition and able to communicate reliable information. And at worst, nutrition information itself can be considered unreliable because studies don't always agree. Now, nutrition information and nutrition research in particular are complex, and generating recommendations based on that research can also be challenging, especially recommendations that attempt to come up with ideas and interventions that are going to work for most people. I'm sure that every audience member here at some point in their life has been confused about nutrition information and what to follow. You've likely encountered hot topics in nutrition, which include things like whether caffeine is harmful or protective, if dietary sources of cholesterol like eggs are heart healthy, and whether a high-fat or low-fat diet is best. These widely disputed issues are not just debated in scientific conferences and government committee meetings. These issues and the recommendations we receive impact all of us every day. Formal nutrition recommendations can take years or even decades to change, and public opinion itself does not often shift very quickly. So you can see that there's a challenge here when it comes to navigating and understanding how we are going to make decisions every day about our nutrition. But nutrition research itself is published daily. And for those of us who don't pore over nutrition studies every day, we might be relying on headlines or social media storms to learn what's new in nutrition. Furthermore, headlines one week might contradict headlines another week. Like all scientific fields, research evolves and guidelines change over time, but misinformation surrounding nutrition and dietary recommendations is especially pervasive. And just to clarify, by misinformation here, we mean something that is incorrect or misleading, rather than intentionally deceptive information, although disinformation has certainly been sown. In most cases, sources of nutrition information are not intentionally deceptive. It's important to understand the complexities of nutrition research. And as you can imagine, there are many confounding factors when nutrition studies are being conducted. Due to differences in study design and the populations being studied, even good nutrition studies can have varied conclusions. And things can get lost in translation when this research turns into press. Perhaps the biggest challenge we face, and part of the reason that nutrition interventions have not been as effective as they could or should be, is that nutrition recommendations are trying to distill vast amounts of information and data into simple, meaningful, and actionable recommendations that will work for millions of people. The problem with this approach is that nutrition is deeply personal. Cuisine and rituals around food are entwined with our sociocultural, ethnic, religious, national, and geographic identities. Food and eating are also about relationships. It matters what you have access to, and it matters the environment that you're eating in. Furthermore, the effects of nutrition on physiological function can differ between individuals. Genetic predisposition, medical history, environmental exposures, and other risk factors all play a role in how a specific food or nutrient may influence a person's response to or affinity for certain nutritional inputs. In other words, one size does not fit all. For example, these genetic variations can explain differences in how caffeine consumption might influence cardiometabolic health outcomes, either increasing or decreasing risk of cardiovascular disease, depending on gene variability. It can also explain how two people who increase their protein intake can achieve really different results. One person experiencing faster recovery post-exercise and improved energy levels, while another person finds that excess protein intake exacerbates pre-existing kidney problems. Unique physiological reactions to the same food make it difficult for interventions to be therapeutically applied across a diverse spectrum of people. So we could see this as a problem, or we can see this as an opportunity to develop and amplify a standardized evidence-based framework for the development of dynamic clinical nutrition guidelines that can be applied with and through healthcare providers and in communities. Guidelines that recognize that one-size recommendations can't fit all of us. There are many complexities, but still rising rates of chronic non-communicable diseases and ballooning costs of healthcare should motivate action. And it is in many corners of the nutrition world that this needs to happen. For our part, the American Nutrition Association, with its deep roots in education and advocacy, aims to be a driving force in building health literacy for communities and health professionals so that everyone can rely on the nutrition information they encounter at the point of clinical care and in their daily lives. But health literacy built upon what information? I just explained some of the complexities in health information and how it's translated into the press. We recognize the inherent complexities of the research itself and the approach to public guideline development. But here's the opportunity to develop not alternative recommendations, but a standardized evidence-based framework that will allow for the development of dynamic clinical nutrition guidelines that can be personalized for individuals in their unique circumstances by health professionals and health experts and leaders in communities. I'm now going to turn the presentation over to my colleague, Alyssa, who's going to share a little more about how the ANA is creating these standards to achieve our health literacy goals.
Thank you so much, Victoria. So this framework, the ANA's evidence standards, will drive our programming, including the education, certifications, and guidelines that the organization develops to equip professionals, increase literacy in communities, and ultimately lead to behavior change and measurable shifts in health outcomes. In developing our evidence standards, we have examined existing frameworks used for determining scientific validity in translational healthcare fields as we sought an appropriate framework to utilize or adapt in the field of nutrition. The primary outcome of our evidence standards work is the creation of standardized, evidence-based clinical nutrition guidelines. Our guidelines will be based on expert consensus around a specific body of up-to-date nutrition evidence. They will reflect the strength of the body of evidence and our confidence in the data. They will clearly state to which population the targeted nutrition guidance applies, including gender, ethnicity, health conditions, life stage, and other unique identifiers. Moreover, they will provide nuanced and nimble interpretation of nutrition research on topics selected to maximize impact among health professionals and the patients or populations they serve, to provide clarity and to dismantle persistent misinformation. Our clinical guidelines will educate the public through the professionals that the ANA trains and credentials. These guidelines will also offer entry points for further personalization within clinical care settings, including one-on-one nutrition counseling with healthcare professionals for whom nutrition falls within their scope of practice. Finally, these guidelines will identify research gaps so that future research can be done in these areas. We are currently developing clinical guidelines using a 4-phased process that involves a review of studies, body of evidence analysis, guideline development period, and the guideline being made public. Now, during the rapid review of the evidence, a team of experts will identify studies for inclusion on a specific nutrition topic and then assess the strength and relevance of each study. In analyzing the body of evidence, a larger team will review the collective research and come to a consensus position on a guideline salient to a specific subpopulation of people with similar traits. During the guideline development period, new guidelines will be made available for a comment period to further collect clinical perspective and provide additional nuanced context. And then finally, after consideration of expert opinions, the ANA guidelines will be made public and will offer up-to-date expert-driven nutrition guidance. These guidelines are designed to elevate the critical role that nutrition should play in health and healthcare. When applied across health professions, industries, and platforms, trusted nutrition information grounded in evidence-based practices can help to reverse chronic disease, reduce healthcare costs and associated burdens, as well as serve as the foundation for optimal health and well-being. But strengthening health literacy and providing unbiased nutrition education is just one piece of a larger puzzle. Community adoption that empowers individuals with education to make healthier choices should be paired with increased access to healthy food options that are financially accessible and convenient. Each is essential for broader societal shifts to occur. Everyone deserves to be nutrition literate, as well as to have the support of health professionals that can help them interpret and implement evidence-based nutrition practices that are personalized to optimize their health. And the ANA aims to reestablish the public's faith in nutritional science as we build nutrition literacy. So thank you all for your time and attention today, and we look forward to your questions.
Thank you so much, Alyssa, and thank you, Victoria, as well. Really appreciated learning more about that topic. So we've got time for questions. I would invite all of our attendees, if you have questions, to pop them in the Q&A feature, or because our webinar chat has been pretty calm, you can also just pop your questions right in chat if you would like, and we will go ahead and address them. So I'm going to start with a question that we had from Jacob Kester. Erin, I believe this came in towards the end of your presentation. Jacob asked, how can peer-reviewed journals build health literacy if the public doesn't read them? Erin, do you have any thoughts on that?
Yeah, thank you, Jacob, for asking. The idea is essentially you have a peer-reviewed journal saying, okay, we have expertise in the following sets of areas, and they have the opportunity through their web presence, through their website, to start producing consumable sort of public health messaging type materials. And that by itself is all well and good, but what will you do with them from there? That's, as I think you're getting at, Jacob, the real crux of the issue. And it's a good question. It's a good challenge. How do you make public information for public consumption, relevant in people's lives? Well, you can get into all kinds of psychological questions there, but part of the goal should be designing information. In our context, it would be information to specifically take on strands of misinformation or disinformation. So defines the information that is going to be relevant in a broader public's life, and groups within different publics' lives. So make it relevant. In fact, PubMed, the Medline portion of PubMed already does this, and you have the CDC and other government agencies trying to do similar things, and they're trying to personalize it as much as they can and make it relevant to different populations within the broader American public and worldwide public, given that it's accessible anywhere in the world. But from there, you get into just essentially marketing questions and marketing strategies. How do you market the following types of social information to members of different groups within society? You can use social media. Of course, you can borrow some of the same types of distribution mechanisms and the distribution models that purveyors of disinformation use. You can turn those right back around and make them work for counteracting disinformation. But beyond that, you're getting into essentially questions of persuasion science. Now, how do you persuade people that the following bit of information is empirically, scientifically fact-based, counters this rumor that's flying around on the web, and you should believe this thing as opposed to that rumor? The elements of persuasion science definitely come into play here. Repetition, and repetition from multiple different sources. If Journal of the American Medical Association does this, for example, that's good. But then, another medical journal comes along and starts doing the same thing. Suddenly, people out there are hearing it from two different sources. That could potentially be more persuasive than just one journal says it. And if it's personalized such that the message lands with impact amongst a given group of people, that's potentially a good way of combating disinformation and dispelling misinformation. It'd be worth doing some research to look into how effective is it and what are ways of making it effective, but that seems like a starting point.
Thank you, Aaron. I really appreciated hearing the term persuasion science. I don't know that I have heard that before, so I'm kind of interested to look more into that.
There's an excellent article written by a communications professor here at WSU about fact checkers. You present a piece of information, a piece of disinformation to someone, and then the fact check saying this is incorrect. If the person is predisposed to believe the disinformation in the first place, they'll reject the fact checker as opposed to disinformation. So it becomes a very intractable problem.
Yeah.
It's easy for me to sort of propose a solution, but making the solution work in reality, that is a significant challenge. It's part of why I have to design an entire teaching module about this sort of thing. And even then, I need to learn what impact it's having and how can I make it more effective.
Absolutely. Absolutely. Well, thank you for your perspective. We have another question that I will pose to Victoria and Alyssa. There's a question, can you talk a little more about how you are interacting with and supporting healthcare providers? In some cases, misinformation comes from the healthcare providers and the patient doesn't always question their advice. I'd be interested if you have any thoughts on that.
Yeah, I can take that question. It's a great one. And you're right. A lot of health misinformation comes from providers, and it's not because they're trying to, like we said, it's not because we're trying to deceive anyone. Physicians, for example, get about maybe 4 hours of nutrition education in their entire medical education, which is not a lot, especially because nutrition really is foundational to so many physiological and biological processes. So one way that we are engaging with clinicians and healthcare providers is by educating. So I shared a few at the very beginning of the slides, a few of the educational programs that we have. We have annual summits. We have online training courses that are geared toward clinicians in nutrition specifically, who really focus on nutrition in their work. And that includes nutritional genomics training, as well as training in ketogenic nutrition and other specialty areas. We certify clinicians both as certified nutrition specialists, which Alyssa and I are both CNSs. And that's really the sort of highest level of advanced personalized clinical nutrition practice, as well as those specialty sub areas and other areas where you don't necessarily need to be a trained and practicing nutritionist, but you have nutrition in your scope of practice or in your toolkit. So one of those courses is called Personalized Nutrition Practitioner Training and Certification. That's for physicians, MDs, DOs, and other advanced healthcare clinicians to be able to understand the application of nutrition in a clinical setting. So we're actually giving them the tools, clinical reference sheets, these guidelines, so that they can go into their clinical practices with confidence and start to talk about nutrition a little bit more. It's continuing medical education for those who are on the ground working and answering questions and trying to support their patients as best as they can every day. So we have the trainings, the certifications, and then we hope that these clinical guidelines will become readily available even for those who aren't taking ANA trainings, so that they can just come and access for free this information and get it into their practices, into their clinics as soon as they can, and really start helping people and transforming health. And I think that the parallel piece of that, so we're educating and training and providing guidelines for healthcare professionals, but we're also working on ways to directly educate the public so that the public can then say, and this happens to, I think this happens a lot, at least in our world, people will come with reams of printouts or, like websites, and they're like, well, this says this about my condition, or what about, these two things I've been reading. And so I think that the clinician really does need to be educated and be able to help navigate and walk alongside someone and accompany them through their health care. So I think both by educating the public so that they can show up and say, hey, I heard this, I read this, this is my understanding of my health situation, and educating the clinician so that they can partner with patients and clients and walk alongside them. That's sort of our two-pronged approach in really trying to help bolster nutrition literacy.
Fantastic. Thank you so much for summarizing that. Yeah, that multifaceted, multi-pronged approach is really, really critical, I think, in all areas of health literacy. I was wondering, Erin, just really quickly, if you had any thoughts from your work on engaging healthcare providers in the misinformation, disinformation conversation.
Well, as Victoria was talking, I'm glad that her experience has been that there's misinformation that's not really explicitly intended to deceive out there from a nutrition perspective. That's encouraging-ish because there are industries out there that will attempt to deceive. One of there's a web designer I met a long time ago. I'm sure many of you have met him too, Peter Morville, who he tells a story in a book, Ambient Findability. Years ago, he was helping the National Cancer Institute redesign their website. And I'll get into the details of the story, but basically, over the course of helping them redesign their website, he found that a lot of cancer, like pharmaceutical companies putting information about cancer online that is intended to get people to buy their own pharmaceuticals instead of provide actual quality information about cancer. So you do get some, malactors of that ilk. It depends on the industry. It depends on the actor. So it's certainly not all an absolute dystopian nightmare, but there are things like that happening out there. One other totally unrelated but useful note I should mention, since I name checked JAMA, I should know if they actually are doing a certain amount of public facing information through podcasts in particular. Their podcast series is quite extensive. And that's, anyone can listen to it, anyone can download it. It's, there's no editorial anything there. It's just the chief editor of JAMA talking to different physicians and people.
That's really helpful. Thank you. I've got one more question for our ANA presenters, and I'll ask if we can keep the answer maybe to a minute and a half so that we can do our wrap-up slides. But I know it's a big question. So when you're reviewing the evidence in order to develop your nutrition guidelines, how are you handling the role of industry and corporate funding and its role in influencing research?
Yeah, that's another amazing question. Thank you for bringing that up. And this sort of piggybacks off of what Erin said, because it's not that there's never been disinformation in nutrition, and there is, and there has been, and even in the Sugar Research Foundation in the 1950s, you all probably have heard this by now, they paid off a Harvard researcher in order to get that person to publish research that said that sugar was not causing, I think it was cardiovascular disease and other conditions, and really to put the onus on fat. And then we had a 30-year anti-fat sort of revolution, I'll say, that we're still trying to disentangle from the way that we decide what we're eating these days.
I teach that in my
yeah, perfect. Yeah. So that is happening. And absolutely, I think that's a fantastic question. The ANA, for its part, we're very aware of this. There are many people that are whistleblowers when it comes to nutrition disinformation. And in terms of corporate influence, we have a pretty stringent corporate relationship policy within our organization. So we do take corporate funding, but all of the folks who engage with the organization, whether financially or with in-kind gifts, must pass a very rigorous evaluation before we will accept that. And then we also limit strongly where they can have influence. So for example, our education and our scientific research, so as it pertains to the creation of these guidelines, cannot have any influence from any corporate partners with the organization.
Thank you so much. I am mindful that we have about 2 minutes left in our session, and I need to do some final housekeeping, closing things. I want to really, again, thank our presenters for being here, Erin, Victoria, and Alyssa. We learned so much from you today. As we wrap up, I just want to let folks know that you will receive an email with instructions to claim MLE CE credit about a few days after the event, after the symposium ends. This particular session is not eligible for CHES certification, but other sessions are. We have 30 minutes until our next session, which begins at 4:30 Eastern. So we encourage you to visit one of the booths in the exhibit hall, maybe go outside if your weather permits, stretch, move, get a drink, whatever's going to feel good to you until our next session starts. And we know that you're here because you're interested in this really important topic. So if you'd like to continue exploring health misinformation, please know that NNLM has an upcoming webinar series, the Health Misinformation Webinar Series. Presentations will be scheduled intermittently throughout the year, and you can learn more about upcoming sessions by checking out the NNLM training calendar at nnlm.gov. So again, thank you all for being here today, for your time and expertise. Enjoy the rest of your afternoon.
Thank you. Take care all.
Thank you. Bye.
Thank you, everyone.